say I'm sorry. I voted for him. I thought he was going to help folks like me. I really did. Now my SNAP's gone, my Medicaid's gone. They cut off my heat and help last week. I don't know how I'm supposed to buy groceries next month or keep the lights on. I ain't got no...
My whole house is on Medicaid. My husband, me, our baby daughter. Okay, we're all on Medicaid. Without Medicaid, I wouldn't be able to have the birth control in my arm that I have. Without Medicaid, I wouldn't be able to have the antidepressants that I have at no cost to me. Without Medicaid, I wouldn't be able to go to therapy to continue to be the mom I am to the 3 kids and 2 separate houses that I have to do. Without Medicaid, my daughter wouldn't be able to go and get her vaccines and go and get all of the things that she needs as an 18-month-old baby. Without Medicaid, my husband wouldn't be able to go and get the medications that he needs and the treatment that he needs for his disability. Without Medicaid, not a single person in my house would have health care. We are low income. Our only income is my husband's SSI. We're on food stamps. We use food pantries. Okay? Without Medicaid, we would never be healthy. And for us, it's not even like body, it's all mental. For my husband, for me, and then we have a baby who needs Medicaid for vaccines, who needs Medicaid for... I already have 2 children who are diagnosed with autism. So what if she ends up getting diagnosed with autism? We need Medicaid. We need Medicaid. And if you live in America, everybody deserves free healthcare. That's it. I just love you. Have a good day.
You know the big beautiful bill will kick 17 million people off of Medicaid and Medicare, right? Yeah, but it's only illegal immigrants. Illegal immigrants don't receive Medicare or Medicaid, at least not from the federal government in the way that citizens get Medicaid. They only get it for emergencies, like if they're actively dying at the hospital. But there's all these able-bodied young men who aren't working and are just sitting there collecting Medicaid checks. You don't collect Medicaid checks. That's not how it works. You go to the doctor and you pay for that with Medicaid. You don't collect checks. So the only people that are using Medicaid are the people that are sick and need to go to the doctor. Well, I just don't think that I should be paying for other people to go to the doctor. I think that they should get a job and work hard enough so that they can be able to afford it themselves. But this bill will affect single mothers who are trying to work 2 or 3 jobs to pay for their kids to go to the doctor. You don't want their kids to go to the doctor? If a mom isn't wealthy enough to have a kid, then she shouldn't have had a kid in the first place. But y'all made abortion illegal.
I'm not on Medicaid, so why should I care if Congress cuts it? First of all, it's not just a cut. They are terminating healthcare for over 13 million people. They're terminating healthcare for kids, cancer patients, working families, elderly in nursing homes. But again, if I'm not one of those people, why should I care? Here in America, our healthcare is extremely expensive. So if we stop paying for people's healthcare, then wouldn't our costs go down? Cutting Medicaid is not going to help the problem. It's actually going to make it worse. Our premiums are going to keep going up, and hospitals are going to close. And the same wealthy people and corporations that are responsible for our rising healthcare costs are actually just going to get a tax break. And do you think they're going to pass that on to you? A $700 billion cut is being rammed through Congress right now, and it is the biggest cut in history. And they'll try to blame this on waste or fraud or undocumented immigrants or people who aren't working, but it's not about any of that. It's about greed. And if you don't want to let them get away with it, share this video right now. Because if you think they're just taking healthcare away from them, you're next.
Picture this. Voting for somebody who's literally taking away your Medicaid. Yes. Hi, my name is Nishika. Welcome to Nishika Talk. Today we are talking about Medicaid.
Dear Republican lawmakers, I'm an unemployed young person living in my mom's basement, and you just voted to take away my Medicaid. And you said that I needed to get a job because I'm a lazy bum. Well, here's how I became the lazy bum I am today. A year ago, I was employed, therefore I deserved health care. I was building buildings for our great nation. I was presenting research at conferences. But I got COVID, which developed into multiple chronic illnesses, which made me really lazy. Here's me lazily getting tested for my debilitating chronic fatigue. Here's me getting infusions because COVID destroyed my immune system because I'm so lazy. I was taking all these pills trying to maintain my job, but I was just getting sicker and sicker. Or, lazier and lazier, am I right? I got so sick that I needed to quit my job, leave the life that I had built, and move in with my mom, and it was all because I was just so lazy. I quickly blew through all my savings to maintain my health care, and because we're so far from a cure from long COVID, and let's be honest, who wants to fund that anyway, I had to get on Medicaid to maintain my health and keep myself alive. But now you've introduced work requirements to Medicaid to cure me of my laziness. I have the privilege of neglecting my health until it becomes a medical emergency and then showing up to the ER and then after that declaring medical bankruptcy. What freedoms? You'll probably tell me that this can all be avoided if I apply for disability, but we both know that that will take years to approve, if at all. So thank you, Republicans, for selling out my health for Jeff Bezos' next yacht, just as God intended. I'm proud to be an American.
Today I was at work at a doctor's office and we got a triage call from a woman whose husband was very sick and she was looking for some advice of what to do. And after talking with her for about a minute, it was obvious that she needed to bring her husband to the hospital. So I told her, you need to bring your husband to the hospital today. And she said, he's in a wheelchair and I can't get him out of the wheelchair into the car. I have no way of getting him there. So I said, call 911. This is what 911 is for. They will send EMTs to your house in an ambulance and they will transport him to the hospital safely. And she said, well, first of all, even if we do that, I have no way of getting him home because the ambulance won't take him back home again. And he has Medicare, and Medicare doesn't always cover ambulance rides, and we can't afford the bill. So I called the hospital and asked them for some advice, and the social worker asked, do they have Medicaid along with Medicare? Because if they are low income and have Medicaid, then the ambulance ride to the hospital and the shuttle ride home will be free. And I said, no, they are not poor enough to qualify for Medicaid, but they don't have enough money to actually afford the ambulance ride to the hospital. I was closing out his chart at the end of the day, and I noticed on his list of doctor's visits, I could see that he had not checked into the hospital today. He was sitting at home all day, withering away, because they couldn't afford the ambulance ride to the hospital. Life is harder for your parents than you think. Sending them a text is not enough. They need your help.
I really don't understand tariffs, honestly. I just know they f***ed us up.
All we heard was drill, drill, drill during the election, and now all we're getting is drilled into the dirt with these prices.
If you could talk to President Trump directly right now, what would you tell him?
Should you want me to really say it on air? I say, F*** you. And I don't mean to be disrespectful to any leader, but he's disrespectful to us, and he doesn't care.
What you just heard right there, those are all former Trump voters from right here in Ohio. And right now, they're souring on President Trump.
The average American is struggling to make ends meet right now. And nobody wants to hear the war's almost over. Nobody wants to hear it's going to get better. You've had a year to make it better at this point. Make it better. Make America great again, right?
White working class voters propelled Trump to victory across the Midwest.
A vote for Trump is a vote to keep those manufacturing jobs in America and add a lot of jobs.
But for rank and file union members like Annette Dombrowski, whose factory is shutting down because manufacturing is moving to China, President Trump's campaign promises are ringing hollow.
He promised to impose tariffs that would bring back American manufacturing. How do you feel about those tariffs and how they've impacted you?
Well, obviously it didn't work now, did it?
You've had a couple months to try and get a new job. What has that process been like?
Depressing. Since January, I have been applying, and it got so bad that I almost had a breakdown in March. I actually have panic attacks.
And Chris Tackett, a truck driver who voted for President Trump 3 times, says he's no longer a fan of the president.
He's backtracked on every single pitch point he had during his election. He's backtracking on. I think it was all smoke and mirrors during the second election. I think Trump is more concerned with getting even with his opponents this time around than he was looking out for the average Joe that supported him. And yeah, I'm just disappointed.
A woman on Twitter said that a lot of people are about to lose their Medicaid and not realize it because their insurance is called something else in their state. perfect example would be Texas, which is Star or Star Plus, CHIP, Georgia Pathways, New York State of Health, California, CalAIM or Medi-Cal, Maryland, Health Choice, Illinois, Health Choice Illinois. These are just some examples. And people really don't know that their insurance is Medicaid because they don't know what the real name is. I mean, even Florida has an acronym. It's SMMC. If you're not paying attention, you wouldn't even know that that's Medicaid. All I'm saying is that a lot of people are about to suffer, and it's not a fault of their own. It's just the government doesn't want to help you.
The people who's in favor of Medicaid being cut drastically and think it's not going to affect you and in fact it's going to help you, I want you to honestly think about all of these things. Medicaid is a major funding source for many hospitals, including rural and community hospitals. If they no longer have Medicaid coming in and you have patients coming in with emergencies, you still have to treat them. You still have to treat people whether they have insurance or not in an emergency. So now that people are still going to be getting the same care, but now the hospitals aren't going to be reimbursed. And if hospitals aren't getting reimbursed, they can't keep the lights on. They can't pay their staff. They can't get the supplies, the equipment. Is this all making sense? So then they can't pay anyone and they have to shut down. And you're like, great, but we still cut Medicaid. We're saving all this money. Okay, so now the hospital is shut down, which means everyone's gonna have to divert to the other hospitals, which may not be close. It may not be close. If you're also one of the people who's proposing that more women should get pregnant and have babies, where are the moms going to go to deliver their babies? What if they don't have a hospital nearby? What if they don't have access to care? Or if they can't get in anywhere? Because when more hospitals close, right, they're gonna have to divert to other places. What do you think is gonna happen with the wait times? Now you need to go to the hospital for some reason. You have insurance. How much longer do you think you're gonna have to wait now that there's no other hospitals nearby because everyone's going to one place? The wait times are gonna get longer. The healthcare staff is going to be stretched more and more thin than they already are. The hospitals aren't going to hire more staff. They're just going to stretch the staff thin. And care is going to decline. It's going to take longer to get care, and the quality of care is going to go down for everyone, not just people with Medicaid or who don't have Medicaid. No insurance at all. It's going to affect everyone. Do you know how many children have Medicaid in this country? Not only are women and children going to be affected, but we keep talking about how we have a mental health crisis and we're in a mental health epidemic. What do you think is going to happen when mental health facilities and mental health units are being shut down? Where are these people going to go who are in crisis? Where are these people going to go when they need a mental health provider and there are none? If we think we have a mental health epidemic now, wait until Medicaid is cut, because how many people who get behavioral health services have Medicaid? Not all people, but a lot of people. So there's a trickle-down effect. There's more than just a simple, we're cutting Medicaid and it's gonna save us money. Think about all the money it's gonna cost for all these things, let alone, not just the money, but these are people's lives. So what do we think about homelessness? What are those rates gonna happen? Incarceration, people with a crisis, maybe who's feeling like they don't wanna be alive anymore. They might not have somewhere to go. So just think about it.
This was a big one for President Trump during the re-election campaign. Now with the power of the pen, he explains via Truth Social, we are not going to pay for our innocent children to undergo these barbaric surgeries and practices, which result in unthinkable and irreversible harm to their young bodies. Thanks to our strong position and pressure on this issue over the past year and a half, dozens of U.S. hospitals have already ended this so-called gender-affirming care, and we expect many more to follow. Just think about all the young, innocent, and perhaps confused children who will be spared. Between 2016 and 2020, there were 3,678 gender-affirming surgeries performed on U.S. minors. We don't know what percentage of those were paid for by Medicaid, but moving forward, that number will be zero.
We're talking about children, the most vulnerable population of them all. And as physicians, we take an oath to do no harm, and we failed them. We also take pride on providing medicine based on evidence. And if you're going to provide irreversible surgeries, life-altering on minors, you better damn well have overwhelming evidence to support this, and this just wasn't the case.
So there are practical implications and also political, because if a 2028 Democrat for president wants to reverse this and go back to using taxpayer dollars for gender-affirming surgeries on minors, they are going to have to articulate why, and they're going to have to go through a whole process to reverse this.
It's over. It passed. And this is what that means for so many Americans. Billions of dollars cut from Medicaid, which affects millions of Americans. The poorest of the poor people in this country are going to lose their health care, be unable to feed themselves, and this is what people wanted. And the richest people in this country will get a tax cut. So if you're not upset, then I'm confused. If this is what you want, I think you need to take a much deeper look at who you are and what you stand for, because this is devastating to so many people in this country. You are often one step away from needing assistance. One step.
They're framing it like he's just snatching 12 million people's health coverage away for no reason, when what's really happening here is Trump introduced a work requirement, saying that before you can receive health coverage free of charge from the government, you have to work at least 80 hours per month.
This figure breaks down adults on Medicaid by category. There are only 4.3 million people without one of the documented exceptions he's talking about. Only 4.3 million able-bodied adults who aren't working who are on Medicaid. So you really can't cut 12 million of those people because there aren't 12 million. And when you look at adults on Medicaid who aren't working, you see it's mainly older people. So if we look at men specifically, women are disproportionately involved in childcare. If we look at men specifically, we see that young men have employment rates of about 90%, and that falls off as they get older. You could imagine a man who's worked construction his entire life, as he hits his late 50s, early 60s, it's hard to keep doing that work. And he may have medical problems that don't quite qualify him as disabled, but do make it hard for him to work, and he needs insurance. That aged construction worker would be one of the 4.3 million. One of the free riders this guy says we should kick off of Medicaid.
You have to work at least 80 hours per month. That is a whopping 2 weeks of full-time labor out of every month. These are meant to be social safety nets, not forever and ever gravy trains that you can just ride while refusing to work.
I'm not sure how he thinks Medicaid works, how it could be a gravy train that people are living off of. Medicaid doesn't give people money. If you are low income, Medicaid will pay for your health care because you can't afford to pay for it. Remember, only 4 out of 12 million people who he wants to take health care away from fit the category he's describing. Only 4 out of 12 million people are healthy and not working. It costs very little to give those people government health insurance because by definition, if you're healthy, you don't need that much health care. You're healthy. Median beneficiary spending in this category is only $142. If you're a 35-year-old man, loser, in your mother's basement, healthy, you don't go to the doctor that much. You don't spend that much on healthcare because you're healthy. There's a higher average spending in this category, which implies to us that some people in this category do need a lot of healthcare. And if there are a few outliers that drive the average up so much higher than the median, that should imply to you that there are some people in this category who aren't that healthy. And he thinks we should take their health care away. I find it frustrating that his logic doesn't even make sense. If they are healthy, they're not spending any money because they're healthy. If they're not healthy, maybe it makes sense to take care of them. I can see the cold economic appeal of what this guy is saying. Hey, if we take away people's health insurance, we're likely to motivate them to work, and we'll save money by not providing them health care. But I get frustrated when people like this guy pretend to have an underlying philosophy, but really what they're doing is just saying whatever might be useful to defend whatever Donald Trump wants to do today. Meaning, if you actually believed this, I don't think you'd be looking at Medicaid cuts. I think you'd be looking at much larger spending categories like Social Security and Medicare. After all, old people aren't contributing economically if they're collecting Social Security and collecting lots of Medicare. So why don't we cut them off? We could save a lot more money. We could balance the federal budget today by ending Medicare and Social Security. You might say old people paid into Social Security and Medicare with their payroll taxes, but that's not really true. They did pay into it, but they also voted in politicians who spent all of that money and tens of trillions more besides. It's the payroll taxes of current workers that go to provide Social Security and Medicare benefits to current beneficiaries. So why not just apply this logic and say, look, we don't care about other people. We're cutting your benefits to save us money. Stop free riding, old folks. Instead of doing that, we have to cut healthcare coverage for the working poor, pregnant mothers, people who are too sick to work right now, parents of children, and so on. Why? Why? I think there is no underlying philosophy. He's not even the economic sociopath who just wants to save money. He's just coming up with whatever dumb thing he can say. Oh, the 12 million people, they aren't working. I'll never look into that. I'll never double check that. He just comes up with whatever dumb thing he can say to try to support whatever Trump wants to do in the moment. Thanks for your time.
Father David here. Well, as of today, inflation in our country is higher than it was when Trump took office. For many of us, energy prices, including home electricity, have doubled. Meanwhile, working families are struggling in ways that they have not for many, many years, with cutbacks in food stamps taking food away from at least 1.5 million children, and who knows how many are not able to afford their medical insurance anymore because of drastic cuts in the subsidies to the Affordable Care Act. All at the same time, our Richie Rich in chief is now telling us that his vanity projects at the White House and surrounding areas will approach $1 billion. And no, it won't be paid for by his fat cat friends. It'll be paid for by you and I. This insane war in Iran, which has placed Iran firmly in the driver's seat now, is probably not going to be over until Trump leaves office, which can't be soon enough, but at the cost of tens, perhaps hundreds of billions of dollars. Meanwhile, we are not taking care of our own people. You folks who voted for him because you thought he'd make your life easier. And although he proved in the first term, he is doubling down in the second term that he has no clue about how to govern, nor does he have any desire to make your life better. His only interest is in enriching himself, and that is exactly what he is doing. Our form of government depends on checks and balances, and with a supplicant Republican Party who gives no pushback, it is more urgent than ever that they be voted out en masse when the opportunity arises, because unless we restore balance, then our way of government will no longer exist. And the man who is spewing out propaganda on a daily basis that would make Joseph Goebbels blush will continue his destruction of what was once a really fine country. Keep active, folks. Participate. Be registered to vote, and then vote. And we can make this change. But it is going to take all of us. God bless us all.
MAGA people, today I'm talking to you guys. Can you picture yourself looking at yourself in the mirror and staring back at yourself and say, shame on you? Yes, shame on you. You voted for somebody. Right now, he's literally coming to attack your health insurance. Yes, I'm talking about Medicaid. Right now, it's going to be so much expensive for so many people, not only just MAGA people, but everybody in America who literally depend on Medicaid to be able to afford to have access to be taken care of by the hospital, by the doctors in America. So right now, you're being told policies are coming into place, and literally it's going to affect millions and millions of Americans. So stay tuned. Let's watch this video and then discover exactly how it's going to affect you, especially people who are under Medicaid. Thank you so much, and please subscribe to my channel.